Hi, I'm Helena, and today I'm going to show you the HERMIA Neurology software. First of all, we're going to look at the normal template for DaTscan. So this is the EARL template that was the result of a big multi-centre European study to make a normal template for DaTscans. The first step is to click Go in the software, so I just hit that Go button. What it's going to do is take your patient DaTscan and align it with the normal template. So we have, from that big multi-centre study with more than 100 normal patient scans, a template was made, like an average image of all of those normal scans, and that's what we're going to compare your patient scan to. The registration that we've done is really advanced, so it doesn't do the whole brain in one go, it does it in hemispheres, because we found that the distance between the striata, which is the area of interest for this tracer, is very variable depending on the patient. So we found that we had to do this hemisphere-dependent registration to make it work. So the software has done the registration, and now we're seeing the results. So if we just zoom in on this one, just to zoom it up, so we can see the striata here. We've got this outline on, so we've got a isocontour on the template. So this is the template in this view, and this is very easy to see how well the registration algorithm has worked just by changing the fusion level here. So I'm fusing between the normal templates on the left of the fusion to the patient scan on the right, so you can see how well the template has been fitted to your patient. As well, so it's a little tricky to check this because they're both nuclear medicine scans, both in the same colour table. We can just stay right on the patient scan and make use of this isocontour, which is set on the template, just to scroll down and check for the whole length of the striata that they're going to be fully included. Yeah, that looks good. So the region map that, or if it wasn't good, if the registration is not so good, we have some manual tools to be able to correct that. The region map that's being applied to calculate the statistics looks like this. So we can see that in this view. We have the striata split into chordates and putamen, and then we have the occipital cortex as the background region. A really nice feature is that as you click on this region, it triangulates to it in the table. So the calculated statistics are the specific ratio. So this is the counts in these regions of the striata as a ratio of that in the background in the occipital cortex, -1 for the specific ratio for DaTscan. So that's the number that you see down here, so 2.33 for this right chordate. The number in brackets is the Z-score. That shows you how different that ratio is from the normal template. So this is your statistical measure of how abnormal or not your patient is. So we can see highlighted in red here, we've got the left chordate and the left putamen region. Both of them are statistically significantly abnormal according to that normal database comparison. And that does link up as well with what we're seeing visually, so we can see reduced uptake in these two regions. That data is represented visually in this table and this nice bar chart here. We also had the possibility to apply a camera correction. So this is a correction that allows you to match your local camera to the average database camera, and an age correction because of the known normal decline in striatal binding with age. Once you've done with your analysis, you can take some print screens. So we have a set of print screens already defined for here. So you can just click on this button. The application generates these print screens as the table, this Z-score plot. So you can save those. And if you want to as well, you can just take a quick print of this overview as well. In this same software, we also support different neurological traces. So what I'm loading now is an FDG PET-CT example. So as before, the first task for the software is to align your patient scan with the template. So I'm going to click Go to start it off doing that. We're using a combination of affine registration as well as a warp as the very last step to just make that fine adjustment to the registration if needed. Also, you'll notice here that we've got an MRI scan loaded with this patient. This is actually an MR from PACS that we were able to retrieve, and then the data from this application can be shown fused with that MR to help with the anatomical correlation. So what we're seeing in this view is the patient scan with some abnormal clusters overlaid. These areas of white here signal where the difference between the loaded patient scan and the normal FDG template is statistically significantly low. So we're looking here for areas where the uptake is lower than the normal template. And we can visually confirm that. So if we just take the fusion off, we can see here that this cluster of abnormality nicely syncs up with this low uptake area compared with the template. But that cluster really just helps to emphasize that. We have a full region list of lots of different regions of the brain, with the ones that are abnormally low highlighted in red. Again, that's based on the Z score, which is a measure of the statistical difference between the uptake in this area of your patient and the normal uptake. We have this really nice view as well, which is a sort of surface rendered difference image. So what we're seeing here is the biggest area of difference, but displayed on the surface of the brain to really help give you a clear overview of the scan. And this view here is showing you that difference image, this time in slices, overlaid with the anatomy that you've loaded, in this case an MR. This could just be the CT that the PET was acquired with. Or in fact, we have a template MR as well if you don't have an MR available for your patient. We can also view this. So there's lots of possible layouts of this application. Let's have a look at the splash view. So we can load this slice by slice as well if you want. Again, completely configurable to how you'd like it. So let's have 3 rows there. And so you can take a screenshot at whatever point you'd like to save for PACS. We also support amyloid PET traces in this application. I'm loading an example of the flutometamol tracer here. We have a really clever adaptive template to be able to register these scans. There is a problem with registering where the more abnormal the patient is, the more difficult the registration. The abnormality level affects the registration. So we have an ingenious way of getting around this called an adaptive template. The template that's used is actually fitted or balanced or weighted to match the abnormality level present in the patient. We also have normal templates for the 3 PET amyloid tracers, amyvid, flutometamol, and florbetaben. This is an example of the amyvid tracer. We have a really innovative algorithm which uses an adaptive template to make sure that the registration is not affected by the level of abnormality in the patient scan. And we have lots of publications on that as well, if you're interested. So again, looking at a similar display in the software, different regions this time, so the regions that are useful for amyloid assessments, and the same results. So this time SUVR is calculated, in this case relative to the cerebellum region, and then the Z score, so how different they are from the normal template, SUVR is in brackets, and anything that's abnormal, in this case much higher than the template, is highlighted in red. And the same or similar format of the overview of the difference image surface rendered onto this brain as well. Thank you for watching this video and for your interest in HERMIA software.